health equity, right? Getting to your definition. It's giving everyone a fair opportunity to reach their optimal level of health, right? Or their full health potential.
Welcome to the AHA's 53rd annual membership meeting. Let's give another round of applause to the Northwell Nurse Choir. Northwell nurses and frontline caregivers everywhere, we lean on you for your skill and compassion and your smiles and your tears. You have proven that hospitals are indisputably the most trusted partner in serving patients in communities that every American depends on and leans on.
Whatever you do, you are in the hero business.
It is completely contradictory to have a cut to Medicare and to hospitals while we're still in, as you said, an active PHE, declared public health emergency.
Dr. Fauci, the crowd is eager to see you and to celebrate you. So let me tell you about the award. This award is given to individuals in recognition of exemplary contributions to the health and well-being of our nation through leadership on major health policies or social initiatives.
I want to thank all of you for your good work, especially over the past 2+ years, as our country and the entire world have battled COVID-19.
I need you all to help me figure out what are those retention strategies that are working.
We've got to address the work environment. We've talked, I've talked about staffing, we've talked about the mental health, but workplace violence has to be addressed.
Mindy, our objective is really to develop and convey to the field data, resources, best practices around delivery systems, care models.
As bad as it gets when it comes to maternal mortality and morbidity. We're such a wealthy country. We've got the best science and best medicine, yet in some pockets of America we have results for women who are having babies that are worse than in some of the developing world. And so we have made a major commitment to trying to deal with maternal morbidity and mortality.
The quick movement to a vaccine exceeded anything anybody would have anticipated. 2 years would have been a record. 9 months was unbelievable, but the way that vaccine was developed to where you weren't really giving somebody you weren't giving them a disease, you were giving them what it took to recognize the invasion of COVID and then react to that, means we should be able in the future to develop similar vaccines in similar ways.
Welcome to day 2 of the AHA annual membership meeting. We've got another terrific and jam-packed program today.
We can't leave any area unserved. There shouldn't be an area. You can live anywhere in America, and you should have the quality access to service. So at WVU Health Systems, what they're able to do, their telehealth, connect you with some of the best specialists we have, sitting in Morgantown, basically, giving services where any part of West Virginia.
How do we keep people healthier longer? How much more can we do with prevention? How can we be ahead of things? How can we increase access to care, lower costs, all the things that maybe get in the way of keeping people healthy?
How do you speak to the public in a way that you can be a voice for science, for health, and be a credible voice that too? That's something I think that we need to do more to actually train clinicians on, and frankly public health workers as well.
Thank you, thank you, thank you for everything you've done over the past 2 years fighting for our hospitals and our healthcare workers. We never could have made it this far without our brave frontline healthcare workers.
America's hospitals were the front lines of a once-in-a-century pandemic. Your brave providers were the first to grapple with COVID-19's most devastating effects, caring for patients before there were vaccines or treatments with limited medical supplies and equipment. And you're still the ones to respond to and care for the sickest COVID patients.
Thank you all for being here. We really appreciate those of you that are going to Capitol Hill. Thanks again. We appreciate your leadership. We appreciate your support. This session is adjourned.